I'm really super proud of you. Do I have permission to say what you shared with me or not? But I'm good if you say that. So Bernice has suffered miserably hearing Jim and Bryce talk now for quite a while. And, you know, I actually profoundly respect Bernice for a trillion reasons, many of which you shared when we had Path of One together. But I know that there are times when I've said what I've said, and I can see it in your guys' faces. It's just like, man, this guy, please just shut that mouth up, okay? Well, she's up to 2 miles on the treadmill and down 20 pounds, and guys, that's flipping amazing, okay? So my hat's off to you, girl, big time. Super proud of you. Welcome. And for team wins on Thanksgiving, I suspect there will be some nervement, but anyway. So, what are we doing here? Disorders of the lower urinary tract. We all know where that's at, okay? So, the kidneys need to get the filtrate down the ureters to the urinary bladder through the urethra. If it's in a guy, through the prostatic urethra and then through the urethra, right? Okay. So, what are we talking about? All of this stuff. Listen. Thank God Mother Nature did not leave getting the filtrate out to gravity. Why? Because it's a supersaturated solution. So we do it by peristalsis. The ureters are profoundly muscular tubes. And they undulate with peristaltic waves just like the GI tract does to get the filtrate out. Okay? Make sense to you guys? I don't care about this. I mean, it's cool stuff to know, but I don't care about it. So, the mechanics of micturition. Micturition, peeing. Okay? Guys, you know I'm going to ask questions about it. Why? It's the only, there's actually one other one too, but to pull off peeing involves the central nervous system, the peripheral nervous system, and the autonomic nervous system. Okay? So time out. If there's a problem with voiding, it can be mechanical, it could be hormonal, it could be behavioral, it could be anything from the brain down. Does that make sense to you guys? Okay. So we have sympathetic innervation, and remember where the sympathetic nerves come out. They are in the T1 through L2 region. Okay? Parasympathetics to refresh AMP2 knowledge, or actually AMP1 knowledge, what I'm talking about. It's actually really embarrassing because I'm lecturing on that this coming Saturday. Uh-oh! Parasympathetic, craniosacral, sympathetic, T1 through L2. Okay? But for the for the mechanics of peeing, yes?
In your notes you have L1 to L2.
Oh, yeah. I'm getting to that. I'm saying sympathetic nervous system is from T1 to L2.
Okay.
The nerves, though, that are involved for peeing from the sympathetic nervous system are at the level of L1, L2. Does that make sense, Margaret? Okay. The door's closed, right? Okay.
Again?
Yeah.
What?
It's going to be a nasty email tonight. Not a text response. It warrants a Jim and Fry's original. So, listen. What's the bladder? Mostly muscle, right? What muscle? The detrusor muscle. So, what does that mean? It can contract, right? When it's under commands to contract. So, this is insane. What does, you would think the sympathetic nervous system would make it contract, but it doesn't. Think fight or flight. If we have to run and get the hell away from some danger, fight or flight, right? The last thing we need to do is, oh, I think I'm going to stop and pee first, right? So what happens? What does the sympathetic nervous system do? It causes the bladder to relax so it can get filled, okay? And it keeps the internal sphincter, which we have no voluntary control over, shut. So sympathetic nerves from L1 and L2 cause the detrusor muscle to be relaxed and the internal sphincter to be contracted so that we can't void. Okay? The parasympathetic nervous system, remember, that's craniosacral in general, but the nerves that are involved in micturition are from S1 through S4. Do we need to know the levels? I'm talking about them, right? Yes, you do. And so, what does the parasympathetic innervation do? It causes the internal sphincter to relax so pee can come out, and it causes the detrusor muscle to contract. So I'm going to say that one more time. Sympathetic nervous system innervation for peeing, which is micturition, L1 and L2, and it causes the detrusor muscle to relax so the bladder can fill, and it causes the internal sphincter, which is the one that we have no control over, to remain shut so we can't pee. And that's the way you remember it. Fight or flight, we don't want to have time to pee. So what does that do? You don't want your bladder to contract, you don't want the involuntary door to open up. Okay? Parasympathetic, what does it do? Well, rest and digest. So what's part of resting and digesting? Defecating and urinating. And so, what does parasympathetic nervous system do? It causes the internal sphincter that we have no control over to relax while simultaneously triggering bladder contraction so we can void. Does that make sense to everybody? The only thing that's remaining is, and it's what we have control over, the external sphincter, and that's skeletal muscle, and that's innervated by the pudendal nerve. Okay? So, pudendal nerve, right there, and external urethral orifice. The only way, it doesn't matter what the hell's going on involuntarily, you guys know it. You're on a plane, you had too much of whatever beverage you were drinking on the plane, you hit a real serious pocket of turbulence, you have to pee like no other, but you know you can't get up, and you're able to hold it, and it feels painful, but you're able to hold it. Why? Because you are sending firing signals from the pudendal nerve to the external sphincter, which is the only thing we have control over, and you keep that baby contracted and shut so you don't urinate on yourself. Make sense? Okay. So, just been through that. So disorders involving voiding. What the hell can they be, guys? Anything. Sexy test questions. It can be anything. Okay? Maybe you have vesicoureteral reflux. What the hell is that, Jim? Reverse peristalsis in the ureter, or both the ureters. Why? Because there's a blockage. From what? I don't know. Infection, inflammation, kidney stone, you name it. Tumor, benign or malignant. So that makes sense to you guys? But it also could just be something that's up in the brain. So Junior's having a hard time not peeing on him or herself, right? So they have to learn how to train what? The external sphincter, to develop external sphincter control. Know how to access the pudendal nerve to fighters. Does that make sense to you guys? What about people that have behavioral issues like public pee scare, right? Well, that's cognitive. So what am I saying? The problems for voiding can be absolutely anything. That's what I'm saying. Okay? There are way more than the 3 incontinences that are on the slide. Way more. So what's urge incontinence? So what happens is a person feels the urge and they pee on themselves before they can make it to the bathroom, okay, or to wherever they're going to be. Does that make sense to you guys? Well, what causes that? A bunch of different things: tumors, stones, some kind of cognitive deficit, or central nervous damage, or brainstem damage, you name it. Okay. What about stress incontinence? Senior citizens, pregnant moms. Okay. The pelvic floor, the urogenital diaphragm, becomes weakened as we get older. All right. And guys, it doesn't matter how many flipping exercises you do, when you get older, okay? I'm not saying don't do the exercises. And then mixed incontinence is a mixture of both urge and stress incontinence. There are many, many different kinds of incontinence. Just know these three, all right? Neurogenic bladder. So it could be a problem with the nervous system communicating below, but it could also be completely behavioral, all right? So there are very many, well, maybe I should use an example. So you can tell when you're a guy, we have urinals, right? You're at the airport. You can tell when somebody has like a social, like behavioral thing about peeing, pee scare, right? It doesn't matter what the underlying cause was, it manifests as a behavioral issue, it's a voiding problem. So medicines might work with those people, but so does behavioral modification. Does that make sense, everybody? Okay. Anuresis. Such a moron. So read that first bullet point with me. Inappropriate wetting of clothing or bedding. Well, when is it appropriate to wet those? Right? Yeah. So I need to change the wording on that slide for next semester. Here's the deal, guys. The big mistake, and here I have it listed the way your book does. So that's typically kids at night. Bottom line is, it's not just kids, okay? If you were a bedwetter as a kid, you are the most, of all adults who accidentally wet themselves at night, who is most likely to do it? Somebody who was a bedwetter when they were first getting potty trained, okay? In general, if you wake up in the middle of the night or in the morning, and there's any moisture on your garment or on the bed, that's something that must be investigated, okay? About 1 or 2% of all the adults who are not senior citizens or compromised patients or whatever, about 1 or 2% of the people who accidentally wet the bed at night, the reason why they're doing that is benign. The rest, not so benign. That's why it has to be investigated. But if you drink alcohol, how soon before you went to sleep and how much, that could be the reason, okay? As a matter of fact, there was a buddy of mine who did a lot of roids, but then he stopped doing that stuff. And his wife called me a long time ago, and his wife called me, she was like, yeah, just Bob, he must know, but like, when he wears the bed and sometimes his side of the bed, it's not sopping wet, but there's evidence that there was wetness there. And I had no idea what the hell's going on. So, simple question, I said, is Bob still drinking pretty heavily? Yeah. All right, well, do a trial run, 60 days, no booze. Jim, I'm not gonna be able to say it to Bob. All right, I'll tell him. You want me to tell Bob? Yeah, your wife called me up and said you're urinating at yourself or you're sleeping. Okay, fair enough, Jim, I'll try talking to him. So he cut the booze out for 60 days. And it took like 2 or 3 weeks, but eventually the urinating on himself stopped. Okay? There may be a legit reason. The 30 ounces, a half hour, an hour before you go to bed of fluid because you didn't drink during the day and you want to be dehydrated. You take all kinds of sympathomimetic drugs or whatever before you go to bed. Why should no one be peeing as an adult on themselves? Because when we go to sleep, the pressure lowers a little bit. Purposely, so we don't do filtration. So if there is urine that's coming out, that means there's a command to filter, and that might mean it's a cardiovascular issue. Does that make sense to you guys? Okay. Talked about this. Don't care about it. Don't care about that. Congenital disorders. So I am here to tell you that there are all kinds of insanity when it comes to the lower urinary tract. There are people who have multiple ureters. There are people that have ureters, only 2 or only 1. Some with none, that's a problem when they're born. Others who have them, but they implant in the wrong place, either on the bladder, or sometimes they implant in places other than the bladder. So there's just a bunch of different ones, and usually you have to do surgical intervention. Some earlier, some later. That's the only takeaway. Does that make sense to you guys? Care about that. Ureteral atrophy, just talking about that. I don't care about ureteral seal. Bladder cancer. So here's the deal. We can't really live without a bladder. I mean, we can do cool surgeries where we make it possible for people to live, but there's all kinds of complications, okay? I don't care that you know it's the fourth most common and eighth most common, it's ridiculous. The bottom line is, who's exposed, who's most likely to get bladder cancer? If you smoke, you're right at the top of the list. If you have smoked, you're still at the top of the list. How about I quit? How long ago? More than 12 years ago? Yeah, not on the list probably, okay? So, carcinogenic chemicals. All right, so I don't see any. Anybody who uses styrofoam? Yeah. Polyvinyl chloride, the polymers used to make styrofoam, highly carcinogenic. It's only, I think it was like 4 years ago, that the FDA finally allowed the disclosure of that after 45 years of successfully blocking and revealing that to the American public. Okay? The aromas in a salon, most of them are carcinogenic, and a bunch of them can cause bladder cancer. You guys with me? Okay. In Europe, there's a recognition if you've been in the hair business for any length of time, at age 50, you're put on pension, you're no longer allowed to work in that environment, because at least they've been honest within their own countries about how highly toxic and carcinogenic all that stuff is. Okay? What about ghost pepper in those spicy preparations that people love to put? Yeah, there's a correlation there too, guys. Okay? I know. So, Jim, what the hell are you going to do on Thanksgiving? Well, I'm not going to be having ghost pepper. Okay? Do you have any of that stuff? Once in a blue moon. I'm feeling exotic. I'm old. I'm still making bad decisions, but just not in those areas. Okay? Guys, listen to me, seriously. The myth in America. I'm just completing one of the greatest books ever written. I think I have it. It's by a woman who was born and raised in Iran. Azar Nafisi. You know her? Familiar with her? Abraham? I love this woman, and she's my kind of peeps in a big time way. It's called The Republic of Imagination. It's absolutely a must read. But one of the things that she talks about is, it's about the importance of reading books, and not just science books, but stuff that stokes our imagination and causes us to be critical thinkers. And you can't be, listen, if you're not looking at art, not participating in artistic endeavor, you're not reading lots and lots and lots of great literature, then I would argue, well, she argued, so you can take the fight up with her, I just agree with her, okay? Then it means you are not adequately stoked in critical thinking skills. I completely believe that. You want to be a really great nurse? Read Orhan Pamuk from Turkey. Some of the greatest fiction in the world. Okay? Read one of my all-time favorite authors, Jorge Luis Borges from Argentina. And if you can't read in Spanish, learn Spanish. For crying out loud and read it in Spanish. Okay? It's amazing. That's going to help me be a good nurse? Oh, hell yeah. Because artists understand the human condition often way better than the rest of us do. So, in any event, she talks about how, one of the things she talks about is that we have, as Americans, we have this we're invincible thing. While I was drunk, I was blotto. Dude, I drank, 16 shots and I had this much liquor. Dude, I don't know, man, I lost count. Yeah, great. I was there, I was a moron too. I'm not condemning anybody for doing that. But the fact that you can get up and run 10 miles like I used to all the time, the very next day, just 3 hours of sleep, fully lit. 3 hours of sleep, go and run. Do a 10K, win the 10K before actually becoming sober. Yeah, it's a myth that we're getting away with it. Everybody pays. It's just a matter of when and how. And you don't know what your body is like. Okay? Urethritis. So inflammation of the urethra. So listen. Anything that can cause an inflammation of the urethra can, at the very minimum, cause the temporary stoppage of filtrate coming through the urethra, right? So there's a temporary stoppage, then there's a backup all the way to where? The ureters and ultimately potentially the kidney. Well, that's the problem. But here we're talking about the urethra. Well, the entire urinary system is at risk if the urethra is harmed, period. Okay? So, STDs, STDs, listen, it is a lie, but we say it. It's true, most STDs, if there's going to be an inflammation, it's going to happen in the urethra. Some, and the STIs, it's the STIs that can climb all the way up to the kidney. Okay? You guys know the difference. STD, Jim, everything is STIs. No, they're not. STIs are bacteria, STDs are viral. STDs, once you got it, it's yours for a lifetime. Okay? So, makes sense to you guys? So the viral ones, they might not climb up. They might indirectly cause problems all the way up by causing stoppage of filtrate flow through the urethra. STIs, they can climb all the way up and actually kill off your kidneys. Okay? How do you treat it? You gotta figure out what the hell is in there. So that means you gotta do culture, right? Cystitis, there's a trillion reasons for inflammation of the bladder. I'm here to tell you, listen, I want you to know this. Who's the person most likely to get a bladder infection? A sexually active white female. Okay? That's the person most likely. Everybody gets them, can get them. That's the person most likely to get it. I want to say it again. It may be on the test. Who's the person most likely to get a bladder infection or cystitis? A sexually active white female. If I don't put in the color of the person, then what? A sexually active female. Okay? Have to know that. There is a weirdly increased number of females who get cystitis compared to guys. Okay? But notice who else is potentially at risk. Obviously, senior citizens, because they have all kinds of other issues. People with diabetes, poor hygiene. No, excuse me. Listen, poor hygiene, and it seems counterintuitive, but it depends on where you work. If you work at the VA's emergency room, or if you work at UNMH on a Friday or Saturday night, you might actually get somebody who's been on the street for 20 years that comes in, right? And they have many different things, and they might come in because, doc, I haven't peed in and whatever, fill in the blank, whatever they say. And it might be, there could be a trillion reasons why, obviously, but it could be because they got an infection, because they needed access to hygiene. Oh, access to hygiene. Right. Well, every country's like America, right? Good running water, really brilliantly clean, beautiful ceramic tile in bathrooms where you can flush as many times as you want. Because, water's free, right? Everybody has access to it. Yeah, not so much. Okay? You'd be surprised. Listen, you go to the Middle East, you don't have to go far out of certain regions to see that there isn't access to running water. Oh, wait, on the res. Yeah, that's where? Here, in this state. There's a bunch of people that I'm going to spend some time with over Christmas break on a particular res, and the people are super excited because it's the first time ever that they're going to have some running water and some electricity. Well, they have traditional ways and they would prefer not to have that. Maybe that's true for some of the elders, I can't speak for them. I know that the people that are my age and your guys' ages are like, what the hell? How come we haven't had running water ever? How come we have to go chop wood to keep a wood stove going? Okay? Listen, guys, I'm all for helping people overseas. We should help people overseas. We've got in this state a ton of people that are backdoor. You claim to be altruistic and benevolent and want to, peace and love and harmony. Yeah, spend some time, 1 weekend a month. Okay? There's a physician that I know who's a Jewish guy. He's married to a Navajo woman, and he's kind of well known in the state. His name is Anthony Flagg, and he runs what's called it's NHI, Native Health Initiative. You familiar with that?
Yeah.
You know Anthony?
Yeah, I volunteered for his
Oh, cool.
program.
Very, very, very cool. He's a lunatic. Okay, so he complains when he does a marathon in 2 hours or like 45 minutes. It's just like, right there, pal. Okay? Seriously? But he does great work. Phenomenal work. You want help? Email Anthony Flagg, Native Health Initiative, and you tell him Jim and Frost told you to. Okay? I'm serious, guys. It's in our backyard. You don't even have to go on the res. It's on the streets here, right? Okay. Oh, yeah, one other thing, catheterization. Right, you put the Foley in, you didn't look at it, the Foley was, put in roughly, it was yanked out or whatever, or hey, we have to put a bigger gauge in, or oh, sorry, I'm gonna go down a notch in gauge, I didn't realize. Yeah, all that can cause lots. It actually can cause long-term damage. Does that make sense to you guys? That's really weird. I have so many idiosyncrasies. I'm always fidgety because I have ADD, and I'm playing with my car key, and like, whose key is that? I didn't even realize. So what happens when people get cystitis? Listen to me. Senior citizen, female, comes into the ER. Absolutely crazy as a bat. Everybody who's at the nursing home who's taking care of her said, we don't know what happened. Sweet little blah, 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 was like really cool. And now she's like a paradise schizophrenic suddenly. Why? First thing you think of, cystitis. Okay? And here's the downside. That often goes undiagnosed. And so some other healthcare professional prescribes antipsychotics. And then all of a sudden you find out when you show up at work a week later that sweet little Mrs. whomever is dead. Because no one diagnosed that it was actually cystitis. Because they thought it was some weird psychotic or behavioral disorder. And all that it was cystitis, and it wasn't treated in time. So the cognitive deficits were the harbinger of death right around the corner. And I'm actually super serious about this, guys. Especially, it doesn't have to be in a senior citizen, but it's typically in a senior citizen just because we tend to diminish their symptoms and rationalize them away. And she's always complaining, whatever, right? So the time frame from developing the cognitive deficits to death, if it's related to cystitis, doesn't have to be that long. Okay, does that make sense to you guys? You've probably transported, right? A bunch, probably, right? And it's amazing, you address the cystitis and the person's actually back to the big one again.
We had one last week. She's a frequent flyer. She has behavioral issues, so we get called out to her all the time by the cops.
Right.
And a family member just called us this last week, and we got there, and she was acting completely normal, like a normal person.
And that was a tip-off.
Yep. And we rolled her out of her bed because you couldn't smell. You can usually smell UTI as soon as you walk in the house. You couldn't smell it, but as soon as we rolled her to get her off the bed, you could tell immediately.
Okay, you hear that, guys? So she was completely normal. What's the point? A profound cognitive change. So normalcy wasn't in this case. Oh my God, she's healed. Okay, I appreciate that. Thank you, Chris. Yeah. What was that?
There's very distinct urine smell.
Oh, yeah. when it hasn't been taken care of. That's the point. And I guess Cheyenne, as Benjamin Cardozo, the famous U.S. Supreme Court Justice, said very many years ago, and Richard Posner, the relatively recent one, said about porn. How do you know it? Because it's been litigated a trillion times. You know it when you see it. How do you know the UTI? There's no way to describe it when you walk into the patient's room or to the house. There's a smell that hits you unless you're congested of allergies. There's a smell that hits you that lingers with your mind for many days, right? Yeah. Yes, exactly. It's unmistakable. Yeah, I mean, Google it for description. Okay, it's noticeable again. You know?
Eggs.
Really bad. Is that like a sign of UTI?
It actually could be. It doesn't have to be. It could be a sign of many other things. But you don't suspect the zebra. You suspect always the simplest explanation
I've always
first.
wondered why older people sometimes you have skin really like, oh.
Yeah, so Cheyenne, Raina's one to give you more description. Okay? Chris and Sapna don't want to because they've experienced it and they're like, ah. So, no, you're right, Raina, 100% right. Okay? It also could be, the smell also could be from profound metabolic problems too. Okay? Painful bladder syndrome. There are many things that can cause painful bladder syndrome. Like what? So, teenage girl comes into the ER, doubled over. This is the 4th time she's missing school. And what happens? The morons at the emergency room do a psychiatric referral and say, she's just doing this purposely. So I actually worked on a case where that was exactly the problem. What happened was this girl had painful bladder syndrome. Now, there are a bunch of reasons why a person can have painful bladder syndrome, drinking lots of carbonated beverages, whether alcoholic or otherwise, ghost pepper and all kinds, whatever, a bunch of things, right? Hookah stuff. But there's also painful bladder where the only thing that you know is that the patient's doubled over in pain because you have absolutely no empirical data to go on. Here's the deal, guys. It's real to them, that means it's real. Period. You don't diminish just because you can't find a causative agent. So there is a particular patient who is a pediatric patient under 18 years of age that when she was born, she had a ureteropathy and a ureterocele. So one of only a handful of pediatric urologists who are in the state did a surgery on this kid and didn't do it well. So this kid has been missing high school. She's being homeschooled now because she spends quite literally about 7 hours a day curled in a fetal position because of painful bladder syndrome. No pediatric urologist. Does anybody work for a pediatric urologist here? No? Okay, thank God. So no pediatric urologist in the state would look at her. All she has to do is give her last name, and I'm sorry, we're going to have to refer you out. We can't see you because no one wants to implicate the person who did the damage to her in the first place. The medical community in Mexico is a very small community. That's all I'm saying. Okay? So, we're done. Let's take a 5-minute break. We're done with all the material that's going to be able